Hi, I'm Nancy Brown, Chief Executive Officer of the American Heart Association, and I'm so honored to be joined today by Bob Bradway, the CEO of Amgen and a proud member of the American Heart Association CEO Roundtable. Bob, thank you so much for joining me.
Thanks, Nancy. It's wonderful to be here with you.
I appreciate it. And I have been so inspired by the work of our CEO Roundtable member companies in helping to fight the COVID-19 pandemic and all of the tremendous work that's being done in healthcare, in pharmaceuticals, in our communities. And, you know, Amgen has been right at the top of the list of helping to provide support during this time. And I wondered if you could tell us what you're most proud of related to Amgen's COVID-19 response efforts.
Well, Nancy, I think the first thing for us is that fortunately our staff and their families have largely been safe throughout this disruption. And so our focus has been on making sure that we do all that we can to help our families and our staff members and the communities that we work in. And again, so far we feel we've been very fortunate. But we're excited to be in the hunt for therapies that might make a difference in this pandemic. And we're advancing a couple of novel ideas that we hope may help in the fight against the disease. But we don't want to lose sight either of the patients that we serve with our medicines, particularly in cardiovascular disease area, Nancy, as you know. And we're concerned about not having those chronic diseases relegated to the back burner while we're all focused on fighting the pandemic, because we know that the effect of that will be negative down the road for society. So we're excited that we've been able to supply all of our patients with medicines, excited that our clinical trials are still moving forward, and encouraged by the work that the AHA in particular is doing to try to keep cardiovascular disease and the things that we can do to prevent it front and center throughout this crisis.
Yeah, those are such important points. We worry a lot at the American Heart Association as we also have ramped up our COVID-19 response, that we cannot forget the basics, that people must manage their cholesterol, their blood pressure, their blood sugar, get the right amount of physical activity and eat an appropriate diet to avoid risks of having a heart attack, having a stroke. Heart disease is still the number one killer of Americans. And I think we've also seen that individuals who have these risk factors are at higher risk for contracting a terrible virus like the coronavirus. And, you mentioned your support of the American Heart Association. We are so grateful that Amgen has joined us in helping to find answers to the questions about COVID-19. And we'd love to hear more about what prompted you to be such a generous supporter, and what do you hope we can do together?
Well, first, Nancy, thank you for convening the effort as rapidly as you did at the AHA. We think there are so many things about this virus that we don't know, and so many things about what its clinical impact might be that we need to know. And so we're delighted that you have pulled together the resources and have begun the studies of these important questions. And as an innovative company focused on cardiovascular disease, we felt, frankly, a responsibility to try to be part of the solution with you. So we know that this virus is having an effect on cardiovascular disease. We know, as you said, Nancy, that those who have existing heart disease are at greater risk, seemingly, of having significant challenges with the virus. And so again, we want to be part of making sure that people who already know that they have heart disease are doing all the things that they need to do to prevent having that become a contributor to why they struggle to manage this virus. So there are lots of things that we can do together as a community. And Nancy, we're grateful for your leadership in pulling together the various strands to try to make that a reality.
Well, Bob, thank you so much for that. And, at the core of some of the work that we're doing at the AHA with support of yours and others, like the COVID-19 registry and the rapid action research grants, we're really trying to scientifically understand what is happening to the human body of individuals who, contract COVID-19, and these unexplainable cardiovascular and neurological events are really of question. When you think about gaps in understanding, what comes to your mind of the issues that you hope we'll be able to address together?
Well, I think, unfortunately, Nancy, there are still so many gaps in our understanding of this virus and its pathological consequences. So we have a lot to learn, and I think the key is to try to learn as quickly as we can and to share the information that we gather in an open forum so scientists around the world have the opportunity to digest it and to build on knowledge with each other. And that's when science is at its best, is when we're able to share it rapidly, when we're able to work as a community to try to improve our understanding. And that's what I see happening. In my career, Nancy, I've never seen a moment where the industry has worked as quickly or as collaboratively across the healthcare ecosystem to try to tackle a challenge. And we certainly have in this particular virus a real challenge, but we're making progress every day. And again, I think the work that we're trying to do to help understand the cardiovascular consequences of this virus will be important, particularly as we get down the road in the progression of this pandemic.
Yeah, there's such important points, and it's been wonderful to see the global scientific and industry collaboration. Everyone's on the hunt together to find, the treatments, to find the vaccine, and to remind people that underlying health conditions can make you more at risk. And those certainly are core and fundamental things at the American Heart Association that we are thinking a lot about. Bob, before I let you go today, is there anything else you'd like to say to our listeners?
Well, Nancy, I would just like to remind everyone that, as you said earlier, cardiovascular disease remains the leading killer of people on our planet. And that's our challenge. Now, the good news is much of heart disease is predictable and preventable. And what we need to make sure at this moment in time is that we're not forgetting that we can predict those who are at greatest risk, and we can take action to try to prevent them from developing significant disease. So I know that we're all focused at the moment on the challenge of fighting this pandemic, but we mustn't do it in a way that creates a secondary healthcare crisis that could have been predictably avoided. So thank you, Nancy, for the work that you're doing and the efforts that you're leading to try to help remind everybody how important it is to manage the risks of cardiovascular disease.
And Bob Bradway, thank you to you and Amgen, because without your support, we would not be able to do the things that we're doing. We are so grateful to you and to the entire CEO Roundtable for the leadership in the AHA. Thank you so much.
Thank you, Nancy.